Hi everyone, good morning. This is Ravi, one of the neurologists, and I'll be talking about stroke today. In case if my audio is not clear, please message or type in the chat box. I'll try to go slow so that we can understand this topic in depth. So we'll be talking about what is stroke, what are the types of strokes, how to recognize a stroke, what are the stroke risk factors, and how to prevent stroke. Just to define stroke in simple language, brain damage caused by an interrupted blood supply to brain. That means whenever there is a blood supply cut off to the brain, there will be a brain damage and we call it as stroke. Now there are two types of stroke. I divide them into clotting type of stroke and bleeding type of stroke. We talk about clotting type of stroke. This is known as ischemic stroke. Blockage of blood vessel to the brain by either a blood clot, as you see in the picture, or by a fatty plaque or a cholesterol plaque. That is called ischemic stroke. It comprises around 80% of stroke occurrences. Now, this is an analogy as how water is important to trees or plants. Same blood supply is important to the different lobes of brain. You can see if a clot disrupt a supply to the plants, they will dry and dead. Same goes with the brain. The another type of stroke is called bleeding type of stroke, that is hemorrhagic stroke. A burst of blood vessels or leakage of vessels is called hemorrhagic stroke or bleeding type of stroke. It comprises around 20% of total stroke. So this is the diagram again. You can see that if there is a rupture of blood vessel, then the supply to the definite part of the brain will be compromised. And again, the brain area will go into a dry state and then will be dead. So the function controlled by that brain will be compromised. That results in weakness, speech problem, and other findings. Now, why we are discussing this topic today on a Saturday weekend? Why? Because stroke is very common. It's fourth common cause of death in Singapore. It's one of the common cause of adult disability worldwide. What is the stroke load? Every year in Singapore, we have 8,000 stroke cases. And 1 in 4% can suffer from stroke. So stroke can happen to anyone at any age and at any time. So this is a myth that stroke only happens to old people. It can happen at any age. What are the consequences or complications of stroke? We start with physical complications or consequences, like disability. If a person has weak arm, weak leg, then cannot walk, will be dependent on either walking stick or on wheelchair. Social complications, because of the disability, he will be anxious to go in a public gathering or social gathering. He will be avoiding the crowded places. As physical disability requires more therapy like speech therapies, occupational therapy, as well as physical therapy, it will definitely keep a toll on the financial problem as well. That means there will be bills, medical bills to pay doctors, and patient can lose their job because of disabilities. All these social and financial problems can lead to emotional stress to the family member as well as to the patient itself. Cognitive problem. Now, what is the cognitive problem means? Due to stroke, there can be forgetfulness, there could be memory impairment, and can lead to dementia. So all these consequences or the complications of stroke should be addressed. Now, there's a very common question asked by my patients: is stroke treatable? So the answer is yes, it's treatable. Early treatment helps to improve outcome. Please call 995 ambulance immediately to seek medical attention. Time loss is brain loss, and I will explain you in my next slides how it is important. Now, people ask about what neurologists usually do when there is a stroke admitted to hospital. So I'll tell you that there is acute treatment of ischemic stroke or clotting type of stroke. Now, when there's a clot which is compromising supply to the brain area or a lobe of the brain, then to begin with, we can give this medication called clot dissolving medication, or we call it IV thrombolysis. That means there is an injection to be given to burst the clot. This by the video, you can see that if this medication is given properly or timely, then it can dissolve the clot. And there are time limitations for that. 3.5 hours, you get good outcome as per the studies. 4.5 hours, you get fair outcome. So come early so that we can detect the problem early and we can fix it early for you. Now, there are small vessels and large vessels. Small vessel clot are easily, or I'll say that the thrombolysis or the clot busting medication can work on small vessel clots. But how about the large vessel blockage or large vessel clots? If the medication or the clot buster injection not working and there is a large vessel clot, which is identified timely, we can offer endovascular therapy. We call it clot retrieval therapy. That means by a groin puncture or by other way, we can go up, reach up to the level of blockage and we can fish out the clot, and then the perfusion or blood supply to the brain can improve, and that can result in proper outcome as well. Now, how to recognize stroke as a patient or general public or non-medical people, how to recognize stroke? So we use this FAST method. F for face drooping, A for arm weakness, S for speech difficulty, and T for time to call 995 when you see any of these features. So remember FAST. Like F, is the face drooping on one side? You can see in the picture that there's one side of the face is clearly drooping on the patient's face. Second one, which is A for arm. Can the person lift up both arms? Ask the patient to lift both arms. If one of the arm is either drifting or cannot lift up, that could be a sign of stroke. Speech. Does the speech sound slurred or strange to you? So family member know the baseline of speech of the patient. If suddenly the speech becomes slurred or strange, then it's time to call 995. That is the last one. That means if you see a face drooping, arm drifting, or a speech slur, please call 995. So remember FAST, fast. Now, what are the other signs of stroke? There are many questions I know you guys are asking, that whether dizziness or vertigo can be stroke or not. So I'm just discussing the other signs of stroke apart from FAST. So what are the other signs of stroke? Numbness of arm, leg could be a stroke. Swallowing difficulty, suddenly choke on water or on food particles could be a sign of stroke. Change of vision or blurring vision or cannot see from one eye could be a sign of stroke. Unsteady gait or fall because of cannot balance their gait, that also could be a sign of stroke. Giddiness. Now, giddiness, if it's established diagnosis of vertigo by an ear doctor specialist and you are having these attacks almost every day, it may not be stroke. But my advice will be, if there is giddiness and you think that this is really, really troubling you, you must see a doctor's opinion. That's the best thing. Headache, especially the worst headache of your life, that is a sign of stroke as well. So remember, all these are also signs of stroke. So now we do a simple quiz that can we recognize the stroke using FAST. So there'll be a polling quiz. I'm reading a scenario and there'll be options. Then you have to choose according to you what will be your step when you see or when you face this scenario. So scenario number 1 is Madam Tan is having dinner with her family in the restaurant. Suddenly she feels weak and sways to her left side. She's unable to pick up her spoon using her left hand. So we know that definitely she's weak on the left side. Does Madam Tan presents any signs of stroke? What will you do if you are Madam Tan's family member? So option A, call 995 for ambulance. Option B, bring Madam Tan to clinic next to the restaurant. C, drive Madam Tan to nearby hospital. Let's see what's your response. You can see a lot of responses coming in. Okay. So is the end of poll already? And let's see the results. Okay, so 80% of people actually chose option number 1, which is call 995, which is the correct answer also. Calling an ambulance will definitely alert a lot of people, like your ambulance people who are actually the trained SCDF people. They actually will provide you the first aid, will get the correct information, bring you to the nearest hospital, and then we can actually, there will be a ED doctors as well as neurologist doctor ready for you to actually assess the condition, and then there will be timely management of stroke can be given. I'll be discussing about that later. So we have next scenario now, and yeah. Next scenario. Aga woke up in the middle of the night and went to the toilet. He suddenly felt weakness in his left leg and was unable to walk steadily back to his bedroom. So, what should be done? If you're Aga, what will you do? Call 995, go back to sleep, or wait and see for a few hours before calling 995? Let's see your responses again. Okay, so 73% actually chose call 995, which is the correct answer. But I think around 28% also says wait and see for a few hours before calling 995. So according to me, when you have clear-cut signs of weakness or unsteady gait, there is no need to wait. Just call 995 for ambulance. Okay, now we'll show that what is the importance of 995 and what is the stroke system in Singapore we have here. Okay, what happens when we call 995? So a team of paramedics will reach to your home. They will assess, they will take the information from you. They will try to see whether you have low blood pressure, your blood sugar levels are low, and then they will give you optimum treatment. Immediately, they will bring you to the nearest emergency department in a government hospital. They will send a pre-notification, and this pre-notification will reach to emergency doctors as well as neurology team, which involves neurology doctors as well as nurses. So the stroke team, the neurology team will be there to assess the patient. And after that, the CT scan room will be prepared. It will be readily available for that patient so that there won't be any time wastage. After the CT scan and once the confirmation of clotting type of stroke is there, then the acute stroke treatment will be provided to the patient. It could be clot busting injection or a clot retrieval therapy. After the acute stroke treatment given, patient will be transferred to the ward, which is called acute stroke unit. So that happens when you call 995. That's why it's very important that instead of driving to the hospital or trying to sleep it off, the symptoms, whether you want to sleep for a few hours and try to see whether it come again, better to call 995 and let the paramedics and the doctors actually to assess you. Now we'll be discussing about what are the stroke risk factors. So far, we know about the stroke burden. We know what are the therapies or the treatment available in the hospital. Now, as a patient or as a public, how can we actually know more about our risk factors and we try to work to control these risk factors so that we can prevent the stroke? Now, the stroke risk factors I divide usually into non-modifiable and modifiable risk factors. Now, non-modifiable risk factors are male gender. That means if male sex is actually have more risk of stroke. Family history of stroke is also another risk factor. Increasing age and history of stroke are also important non-modifiable risk factors. But what are the modifiable risk factors where even patients as well as their doctors can actually act and can prevent complication like stroke? We start with high blood pressure, that is hypertension, smoking. So cutting down or quitting smoking can actually help. Obesity, cutting down weight or go into a healthy BMI can actually help. Unhealthy diet, that means try to go for the healthy diet. Low calorie, low oily, as well as low salty diet can actually help. I will talk more about the healthy diet later. Low physical activity, try to have some amount of physical exercises every day. That actually helps. Diabetes, good control of diabetes by diet control as well as by medications. Heavy alcohol intake also can lead to complications. Psychosocial factors, that means stress, work stress, family stress can lead to poor sleep, also can cause a lot of complications. Lipid level, that means high cholesterol, is a risk of stroke factor, is a stroke risk factor. Atrial fibrillation, I think today's topic, I want to emphasize more on irregular heartbeat, that is atrial fibrillation. I'll be talking about high blood pressure, smoking, as well as atrial fibrillation in my later slides. Now, high blood pressure. What is a high blood pressure? That means when the blood pressure in your body is too high and the organs receiving a high blood pressure can actually go into damage, and that can lead to damage to the blood vessels as well. If you see about high blood pressure, the blood is pumped around the body at very high pressure. That can lead to damage to the vessels and can cause formation of clots. 1 in 2% age 60 to 69 have high blood pressure. Uncontrolled high blood pressure increases stroke risk by 4 times, which is quite high number. 4 in 5 stroke patients have high blood pressure. So we have to understand that high blood pressure is very, very important risk factor to actually prevent. So that if we control it very well, we can prevent the stroke. High blood pressure may not always give rise to symptoms. Therefore, it is important to go for regular health screening. Sometimes the high blood pressure can cause some dizziness or lightheadedness. Even if you don't have any symptom, it is required that at least once a year you should go to a nearest GP or a health practitioner and get your blood pressure checked. If you have a high blood pressure, it is important to maintain the pressure around 130 to 80 by international guidelines or as advised by your doctor. Smoking. Smoking increases stroke risk by 2.5 times. I call smoking as a killer stick. I don't see any benefit of smoking. Smoking can cause cancer, can increase the risk of stroke as well. After 2 to 5 years of successful quitting, stroke risk dropped to be about same as that of non-smoker. So you understand, when you quit, it's not only for months or 6 months. You have to quit for at least 2 to 5 years. Then only your risk came to the as same as level as a non-smoker. If somebody is interested in a quitting program, they can actually follow this website here, www.healthhub.sg, and we can talk about it more later. Next condition, which is a very important condition, and many people are not aware of this condition. It's called atrial fibrillation, or we call it as AF. In other terminology, it's called irregular heartbeat. You can see the ECG. Normal ECG is there's a pattern among there, but irregular, there's no pattern. It's irregular. And this irregular rhythm, or AF, is a disorder of the heart rhythm, which cause the heart to beat irregularly. And irregular heartbeat can cause blood clots to form in the heart. These clots from the heart can travel to the brain and can cause stroke. So remember, irregular heartbeat or AF is a cause for the stroke. 1 in 5 stroke patients have AF or irregular heartbeat. A stroke may occur when these clots travel and block the blood vessel in the brain. It could be a minor stroke, it could be a major stroke. Remember, this AF increases stroke risk by 5 times. And there is a treatment or there is a prevention therapy for that. These are the blood thinning medication. We call them as anticoagulation. These are commonly prescribed to manage AF. Now, is stroke preventable? Yes, the answer is 80% of strokes are preventable. We have to be a bit aware of the condition, our risk factors, and also to diagnose or to identify the stroke symptoms early. Now, how to prevent stroke? As normal public, as a non-medical person, how to prevent stroke? Very simple. First, live a healthy lifestyle. Stop smoking. Limit your alcohol intake. Exercise regularly. A healthy diet comprises of vegetables, fruits, a protein source. It could be a meat source or non-meat source, and whole grain. That is actually suggested by dietitians for a healthy diet. A BMI range, healthy BMI range falls into 18.5 to 22.9. So 18.5 to 22.9 is a healthy BMI. If you don't know about your diet or you have questions about BMI, you can definitely ask your nearest GP or a health practitioner about it. Second, regular health screening. What is the recommendation by Health Promotion Board Singapore? 18 years and above. If we have a high blood pressure, then the screening recommended for 18 years above is obesity health screening is yearly. For high blood pressure is once every 2 years or more frequently as advised by the doctor. Now, if 40 years and above, what are the health screening indications? For diabetes and cholesterol, it's once in every 3 years or more frequently as advised by the doctor. How to prevent stroke? This one, the third topic in this is treatment for high blood pressure, high cholesterol, diabetes, and atrial fibrillation, which is irregular rhythm. So it's very difficult as a non-medical person to manage this at home. I know diet has its role, but medications and doctor's advice also has its role. So attend the medical appointments as advised. Take medications as prescribed. And please go with healthy diet and healthy living, which is exercise. Now, I would like to summarize today's talk. What is stroke? There are serious consequences of stroke I explained. So again, stroke, that means a clot in a blood vessel which cut off supply to the brain, and it can result into disability. It can result into psychosocial complications, which we discussed. How to recognize stroke? Use FAST, face drooping, arm weakness, or speech difficulty, and T for time to call 995. What are the stroke risk factors? I've explained you a lot of risk factors. The important one, which I want to emphasize today, are high blood pressure, smoking, and atrial fibrillation, which is the irregular heart rhythm. How to prevent stroke? Live a healthy lifestyle, a balanced diet, a lot of exercises, regular health screening. That means see your doctor or nearby GP regularly and follow the recommendations of GP or your doctor. And treatment for the condition like high blood pressure, high cholesterol, diabetes, and atrial fibrillation. Now, I would like to show you 2 stroke videos, which is also part of our stroke campaign from Singapore. And after that, we'll actually take your questions as well.
To spot a stroke, think fast. Face drooping, arm weakness, or speech difficulty means it's time to call 995. Fast discovery helps recovery. Strokes are preventable. Lead a healthy lifestyle, manage your blood pressure, and quit smoking. To prevent stroke, know your risk, reduce your risk.
Okay, so these are the 2 videos. Now I would like to thank and take Q&A as well.
Okay, thank you, Dr. Ravi, for sharing the stroke information. We will now taking questions. Yep. So the first questions we have is from Mr. Poon. Yeah, how can we detect if there is any blood clots along the path from the heart to the brain? And are there screening available? It may be a little late to know the symptoms of face droop, blur vision, etc.
That's a very good question. But again, the same thing, we go with the basics. Stroke happens when there is a complete cutoff of the blood supply to the brain. Now, I know that we definitely want to know the blockage is 100%, 70%, 80%, or 90%. But unfortunately, we don't have a screening for these blood vessels, whether they're blocked or not. But how to prevent this blockage from happening is simple. We control the risk factors, which is high blood pressure, cholesterol, diabetes, and also screen for conditions like atrial fibrillation.
Okay, we have another question from the anonymous attendee. How many times can a person suffer a stroke?
Oh, so that's a very tricky question. There's no number for that. But if the risk factors are not well controlled, then a stroke can recur. Definitely, once a stroke, there's always a high risk of getting stroke. And a stroke can be sometimes very, very bad, and it can cause a disabling condition as well as life-threatening conditions also. So that's why once you have a minor stroke or a warning stroke, it's best to follow the doctor's advice and try everything which you can do to prevent the next stroke. And that's how we, the trick is actually to control the risk factors and take your medications on time.
So we have the next questions from Miss Michelle. I have left cerebellar cavernoma. Recently, I felt pain in my left lower part from the back of my face. Do I need to be concerned with the pain?
Okay, so Michelle, this talk is more about stroke, clotting stroke as well as, but the cerebellar cavernoma, as you said, this is a condition dealt by neurosurgeons, and I understand that cavernoma or a blood vessel issue is a kind of abnormal blood vessel growth, it can cause leakage of blood and can cause bleeding type of stroke. So for that, I will advise Michelle that you should follow with your neurosurgeon and take his advice in that. So in case any symptom, just please follow with your neurosurgeon and maybe an imaging will require.
We also have another question from Eileen. Will the volume loss in the left occipital lobe and experiencing of visual field defects considered as the effects of stroke?
Okay, this is a good question, Eileen. So occipital lobe, which is actually is the back portion of our brain, it controls the visual field. So basically, the occipital lobe or this back of the brain actually is needed, should be healthy to actually have a good visual field. If the stroke happen at this area or this region, you can have a visual field defect, and this also considered as a kind of stroke. So definitely, the treatment and preventive therapy should be same as a normal stroke. Yeah.
Okay. Is it more appropriate to detect blood clots with MRI rather than CT scan?
So blood clots are mostly in blood vessels, and for that, the immediate, or we will say that what is the acute kind of imaging we needed is either a CT angiogram, that means a CT scan, which is very fast. Within 10 minutes, we can actually finish this test and we can see the thing easily also. MRI or MR vessel scan is also another tool, but it will actually more time consuming because it's more detailed. It can cause a lot of time loss, like more than 25 minutes. So most of the hospitals in Singapore, they follow a CT angiogram as a first line of imaging tool to find a blockage.
Another question is how do you know if you have irregular heartbeat and other symptoms? Are there symptoms or a screening test available?
Yeah, so it's a very good question that how we'll know that whether I have an irregular heartbeat or not. So irregular heartbeat are not all the time symptomatic. Most of the time there is a symptom called palpitation. That means one will be aware of his own heartbeat. If most of the time, even on the rest also, if you feel your heartbeat quite often, could be irregular or regular, you should actually go and see a doctor. Sometimes it's not picked up in a normal ECG. We have to do a prolonged ECG for that. It could be 24 hours to 72 hours ECG to pick up this kind of irregular heartbeat. For certain cases, we also do a 1 month kind of prolonged monitoring. We call it an implantable loop recorder, where a device is inserted under the skin and then the recording is actually noted. If there's any irregular heartbeat, your doctor will advise you accordingly.
Would it not be better to extract blood clots instead of having blood thinning intake, which is a lifetime consumption and the drug is very expensive to maintain?
So I would like to actually understand this question better. Maybe I'll try to answer a question more about blood thinners. So what Mr. Ronald is actually asking is that whether the blood clot extraction is the mainstay treatment, and after that there's no need of any blood thinning medication to be taken. That's my understanding. But what I'm trying to say that when there is a clot in the brain, there's always an hyperacute management, which is fishing out the clot. Once you take out the clot, that doesn't mean that you now no need to take any blood thinner, because you have taken out the clot today, but this clot can come again tomorrow. So that's why to prevent that clot from re-happening, you have to take a blood thinner medication like aspirin or any other medication as per your doctor's advice, for long term.
We have another one from the anonymous person. Does long-term infarct in the brain has a chance of dislodging and causes stroke?
Does long-term infarct in the brain has a chance of dislodging? Okay, we should understand the meaning of infarct here. When we say infarct, that means brain damage or dead tissue. So if there is a clot, within few hours, that's what I'm saying, within 8 to 10 hours, there is area of damage will be there. And that area of damage, we call it as infarct. It later on forms scar. But whether that scar will cause more complications, from stroke point of view, the area is damaged already. The brain area is damaged already. So it won't cause more complications from stroke point of view, but it can cause many other complications. So if there is an infarct in the brain, that means the damage area already happened. So So after the damage happened, even if you take out the clot, then there won't be much revival of that area because it's dead already. That's why it's best to actually let the neurologist actually understand the condition, whether there's any benefit from taking out the clot and then can save the brain or not. That's why we always say that come early. If you come early, there won't be much brain damage, and we can take out the clot and we can save whatever we can save the brain parenchyma or brain tissue. Yeah.
Okay, thank you, Dr. Ravi. The next question is, how do we define irregular heartbeat, which was earlier mentioned? Yeah.
Okay, I just explained that irregular heartbeat for non-medical people is very difficult to actually catch. Most of the symptoms is actually the most common symptom is palpitations. That means heartbeat very, very fast. So I've always advised that please go to see a nearby doctor, and he will actually act accordingly. Whether how prolonged monitoring is required for them to actually define or detect this irregular heartbeat. It can be sometimes very notorious that with even subsequent many ECGs also you cannot catch this. So if there is any condition like that and your cardiologist or your doctor is actually suspecting, he may advise you prolonged monitoring for that. Yeah.
So, okay. We have someone asking about Miss Tiong, 57, blood pressure 125/85. Seems rather high. Is it likely to suffer stroke?
So again, same thing that the blood pressure is high blood pressure is a risk factor for stroke, but readings of high blood pressure like 150s, 160s, even 170s doesn't mean that there is a high chance that you will have a stroke or is having a stroke at the moment. Basically, these are the alarming signs that one should actually take it very seriously and go and see a nearby GP, doctor, or a health practitioner immediately so that they can advise you the correct medication, correct treatment, as well as the diet management as well. So high blood pressure alone doesn't mean that you're actually having a stroke. Okay.
And we have Scarlett here. I have AF and I already had 3 procedures, but still cannot be cured. Why? Should I go for future procedure? I'm on on-call, and as a parent, I'm under heart center treatment.
So for Scarlett, atrial fibrillation has medical management as well as surgical management. And I think the latest evidence still that says that if you do the surgical management, despite of that, there are conditions, there are cases where the medical management or the anticoagulation or the blood thinner has to be continued for long term. I will advise that you can consult your heart doctor on that, because for me, the atrial fibrillation management, we also involve our heart doctors in the management of patient. And the management includes either a stronger blood thinner, like what you're taking as the Pixaban, or could be a surgical correction of atrial fibrillation, all advised by the heart doctors.
So I think early on we have mentioned about the blurred vision can be a sign, accompanying sign of stroke as well. Maybe Dr. Ravi want to emphasize again.
Yes, as I mentioned that blurring of vision, it could be a sign of stroke. So a middle-aged person, let's say suddenly having a one eye blur and or let's say cannot see completely, it could be a stroke. There could be other causes for blurring of vision. That's why we always have our eye doctors on ground to actually help us. It could be an eye problem like cataract or something which is causing, but sudden onset of blurring or darkening of vision, it could be a sign of stroke. That means there is a clot which is blocking the vessel which is supplying the eye. So it could be an eye stroke. So let your doctor assess your condition as well as advise you accordingly.
So how to confirm that one has AF?
So I think I answered this that there are screening devices. There are actually many modalities where you can actually find AF or irregular heartbeat. You can get more information from either your health practitioners that whether are you on risk of getting AF or not. So definitely they can actually guide on that. But we all go by, we don't screen everybody, or we don't do invasive modalities or investigation to screen for AF. It's all depend on what's your age, what is your risk, and whether you have symptoms like palpitations or not. Yeah.
Okay, does a blood clot in the leg also cause a stroke?
So blood clot in the leg is the same thing that if you have a blood vessel blockage, it will compromise the supply in that part of the body. It could be a leg, it could be a hand, it could be brain. But we don't call a clot in the leg as a stroke. It's actually managed by a vascular team of doctors where they have modalities to actually take out the clot or again the burst the clot. So this doesn't come under brain stroke.
Next, we have good questions. If already on aspirin, can a person still have a stroke?
So any medication or any preventive therapy is not 100% control. Despite of best management or medical management, a person or a patient can still have stroke. So if you're on aspirin, doesn't mean that you are 100% protected. So that's why even if on aspirin, if you have symptoms which is FAS, then time to call 995 ambulance. Yeah.
Does loss of consciousness, leak of urine, consider suffer from stroke?
This is a bit, I'll say, unusual sign of or symptom for stroke. Loss of consciousness may or may not be a sign of stroke because this doesn't come into the normal signs of symptoms of stroke. But a major clot in one of the vessels in the back of the brain, we call it a basilar artery. If actually it's blocked, then yes, patient can lose consciousness and it could be a sign of stroke. So if any loss of consciousness or let's say incontinence, I think one should definitely consult a doctor.
So the next question is why man is in the higher risk of having?
Okay, so why man is on the higher risk? We don't know about it because what I'm sharing with you is the evidence or the data. So in data worldwide, men actually have more high risk. It could be their habits, their risk factors like smoking and other things. But so far there is no confirmed answer for that. That why male gender and female gender have this distribution of stroke risk. Yeah. So there's no perfect answer for that.
So does low blood pressure patients have higher risk of undetected stroke? Example, normal BP is 95 over 70, but a patient already having headache at 130 over 90.
I think there here or there are multiple questions here. First is, does low blood pressure has a high risk of stroke? So low blood pressure can be sometimes normally present in many females. Young females can have normally blood pressure at the low level, like the systolic, the top part could be 90s, sometimes in 85s as well. So that's why they always have to see the doctor, and then the doctor will actually tell them that this is your normal blood pressure. And normal blood pressure may not cause a stroke directly, but if you have blockages, if you have narrowing in your vessels in the brain or in the neck, which is supplying to the brain, then yes, low blood pressure can cause indirectly a stroke. And patient already having headache at 130/80, 130/80 is still considered as a normal range. So there could be many other causes for headache. Okay, for that you have to see a doctor or a headache specialist. But I'll say that having a headache does not mean that you are having a stroke. It could be many other causes. So always best to actually consult your nearby doctor.
Generally, how long it takes to recover from a stroke attack?
Okay, Josephine, it's a very good question. I'll say that it depends on what kind of stroke a person is having. Is a small stroke or is a large stroke? How we divide the small and large? If a small vessel blocked, then mostly it causes less deficit, less disability. And if it's a large vessel blockage, then there are more deficits. So if a person is having, let's say, a small stroke or a large stroke, but if come on timely and if the hyperacute treatment, which is a clot buster medication or a clot retrieval therapy is given to the patient, and then it's actually successful as well, then definitely recovery is good. But the usual recovery varies. It depends on patient to patient and what kind of damage actually happened to the brain.
Because we have a lot of questions coming up, so we will we will answer some questions here. Yeah, if history of strokes is a risk factor of stroke, can a patient already on blood thinners who is suspected of having a new stroke be given TPA or endovascular treatment?
Stroke is a risk factor. Yes, definitely a past history of stroke is a risk factor. Patient already on blood thinners. So what kind of blood thinners? We have different kinds of blood thinner. There are blood thinners like aspirin or clopidogrel, which makes the blood less sticky. There are blood thinners like anticoagulation, like apixaban, warfarin, rivaroxaban, which are different type of blood thinners. So if patient is on a stronger blood thinner like warfarin and other agents, then he is not a candidate for clot buster injection because it can cause more harm to patient. But a clot retrieval therapy is still on or is still an option for the patient. So let the neurologist or the team on the ground to assess the situation, share your medication list with the family member, with the doctors, and then let them decide. Yeah.
So some of the questions we will try to answer by our panelists back end. So the next question for Dr. Ravi would be, what happened if I'm alone at home and got stroke? What can I do?
Okay, that's a good question. So what we can do when you're home alone? So definitely the most important thing that if you see that there are symptoms, either those FAST method or any other symptoms, what I mentioned, if you think that there is a stroke symptom, best is call 995 ambulance if you can. Otherwise, call your family members and ask them to call 995. Ambulance will be there and then to help you. What you can tell your family member, or let's say you're alone, then you just get your medication list ready and then wait for the ambulance to come and give them the correct time of onset. See, the time of onset is very important. If you had a symptom at 8 o'clock in the morning, then you have to tell them that 8 o'clock I actually had these symptoms. If you wake up with your symptoms of stroke, let's say you were sleeping and 8 o'clock you woke up and you notice that you can't talk properly or your hand or leg is weak, you have to say that I slept at 11 in the night last night and then I woke up, I already have this weakness. Then this kind of history is very important for the neurologist to make the decision that what kind of correct therapy or treatment we can provide to the patient.
The next question is it true that after the first occurrence of a stroke, there could be another within the next few hours, like a critical window immediately after the first stroke?
So again, it depends on what kind of stroke we're talking about. There is a type of stroke, we call it warning stroke, or we call it TIA, transient ischemic attack. In this kind of warning stroke, where the symptoms will be there for a few minutes and after that automatically resolve. These kind of warning stroke can have another stroke, repeated strokes. So definitely that's why it's important that when you see this or when you face these symptoms first, immediately call ambulance and let the doctor decide that what is the best thing for you. So yes, the warning stroke can lead to a major stroke.
Okay. So the next interesting question coming up is acupuncture recommended for stroke patients?
Sorry. So the question is whether acupuncture helps or recommend in stroke patient. It depends on what kind of disability we're talking about, what kind of therapy is actually recommended, and whether patients on different kind of blood thinners. If you are on blood thinning agents, which are very strong blood thinner, any kind of acupuncture needle poking therapy can actually cause bleeding. But again, I say that I won't encourage or discourage patient on this therapy because as a neurologist, I don't practice these alternative medicines, so I won't be able to answer much on this. But let your practitioner or your whoever is actually giving you therapy know that what kind of medications you are on and what is your condition in the past. That will help him to decide.
Okay. Do stroke patients need to take medication for life?
At the moment, the answer is long term. But as we know that medicine is developing, there are new advancement or development coming every day. We don't know tomorrow if there's a new drug which comes and you have to take only once a year, or maybe a one drug which is for 6 months or few months. So for now, what we have is those medication you take every day and which that will give you protection for that day. If you miss next day, then definitely you're on a risk. So it's always advised for the stroke patients, best is to adhere to the medication dosage or regime and please be compliant. That means take medication every day at the moment. Yeah.
Okay. Is insomnia a major cause of stroke?
So insomnia, that means sleep problem, cannot sleep. Poor sleep is also one of the indirect cause of many diseases or many complications. At the moment, we don't have any major evidence that insomnia can cause stroke directly, but definitely it can cause a lot of complications. Your blood pressure control can go haywire if you don't sleep well. Your food intake also related to sleep. Let's say if you're not sleeping and you're eating more in the night, that can actually fluctuate your blood glucose level. So your diabetes control can go bad. And all stress or lack of sleep also take a toll on heart conditions as well. So that's why at the moment or is till now, there is no direct evidence from insomnia causing a stroke, but this is one of the major thing which we have to look after, and so that we can prevent the complications.
If I have blurred vision, worse headache, weakness, but still able to lift my arm and smile normally, can it be a chance that it's a stroke?
So blur vision, worst headache, and weakness. Again, I'll say that headache, there are many causes for headache. It could be migraine headache, it could be tension headache, or it could be stroke. We don't know. But when you have blur vision, when you have weakness, these are the symptoms of stroke also. So best to let the doctor assess you. Don't just sit at home and then wait for them to actually subside. Best, even if you don't want to call ambulance, let's say if you have a headache and you're in doubt, you can actually you go to a nearby doctor and see that you are having a regular headaches and these are your symptoms. But for those people who have the first time blurring of vision, weakness, and never happened before, please call 995 ambulance and go to a nearby hospital and let the stroke team assess you and give you advice.
So we have a question by Varun. In your clinical experience, have you seen patients with good healthy lifestyle, no medical history, but to suffer from stroke?
Okay, I don't want to discourage anyone, but majority, if you are healthy and you're following proper health screening and you control your risk factors well, definitely there's a chance of less and less stroke. But yes, we have seen many healthy patients also getting stroke because the causes are something else. So there are many rare causes of stroke which can happen, and then even young people also can get stroke. But still proven, or if you ask me what is the evidence based, is that you get your health condition checked regularly, you take your medications and advice from your doctors regularly, definitely you will be on the lesser risk of stroke as compared to one who's actually not doing that.
The next question is also by Varun. Can you talk a bit more on the next steps after a stroke incidents, like rehabilitations, and how long would it be?
So, Varun, depends on the type of stroke. If it's a mild stroke, the therapist, which are like physiotherapy, occupational therapy, speech therapy, they will actually guide the patient that how long they have to do therapy and whether it will be an inpatient hospital therapy or whether they can actually do the therapy from the home. That means go every day to the day rehab center and then do exercise. For major stroke and major disability, the stay in hospital can be a bit long, and it also depends on patient to patient. Young patients have more recovery, elderly have slightly lesser, but also if they are good potential patients, then definitely the chances of recovery are always high. Okay. Okay, we have.
Who is at risk of AF?
Okay, we actually explained this that atrial fibrillation can cause stroke, and atrial fibrillation with many conditions. If let's say like female has more risk than male, age with atrial fibrillation also have higher risk. Prior conditions like high blood pressure or previous history of stroke with AF have more and more risk of having stroke. So once you are diagnosed with a condition AF or irregular heartbeat, best to actually get opinion or advice from the doctor. It could be neurologist or cardiologist, and then get the treatment from them. There's another question, which is how long can a stroke wait? So it's a very good question. I think that's my appeal that if somebody detect any stroke symptom It could be slurring, it could be a weakness of arm, numbness, or a very bad dizziness never happened before. Please don't waste time and call 995 because time is brain. You come early, the imaging CT scan will be done early, and the treatment will be given early. So I just want to tell you that when there is a pre-hospital notification for a stroke case, whoever, let's say in any government hospital nearby, somebody call 995, the paramedics will inform the emergency department nearby, the nearby government hospital, and then the emergency team doctors, neurology doctors, and also neurology nurses will be waiting for the patient to come. Then the emergency team doctors will get more information. Neurologist will assess the patient and will get a clinical information from that whether it looks like real stroke or not. Our radiographers, a team of radiologists, they actually prepare the CT scan room readily available for the patient, so that there won't be any wasting of time or any waiting for the scan room to be ready. Patient will be pushed to the CT scan room. The brain imaging will be obtained with that clinical information, with the CT scan of the brain, as well as the information from the family members or the patient. Neurologist will make a decision that what kind of stroke we are dealing with and what are the risks, and based on that we'll be offering treatment, whether we have to offer you a clot busting medication injection, or we have to actually give you clot retrieval therapy, or both, depending on the patient's condition. So that's why do not waste time. Time is brain. Any minute loss means neurons loss or the brain cells loss. So please come to the hospital via 995 ambulance ASAP when you have symptoms.
Okay.
Another question here, Celeste, you want to, if I have a family member who had a stroke, does it mean that I'm more high risk of getting it? So family history of stroke is definitely considered a risk factor because there are many causes for that. Even cholesterol level, high cholesterol can be genetically predisposed. So if a father or mother has, let's say, diabetes or a cholesterol problem, it can pass to their kids as well. So they are on the risk, definitely. So once you have a family history of stroke, whenever you see a doctor, you mention this to the doctor. It could be your primary doctor, it could be you're seeing any specialist. They should write this down in your health records, and all the government health records are actually seen by all the hospitals. So is no problem that you are actually going to other hospital and A hospital or B hospital cannot see. We can see all the records. So we call it NEHR, okay, electronic health records. So best to actually give more and more information to your doctor.
What are the rare causes of stroke?
Okay, the rare causes of stroke, there are many. In young, we have seen rare causes of stroke, which is tear in the blood vessel. Any kind of contact sports, or sometimes even very strenuous or rigorous neck manipulations cause tear in their blood vessels. Now, not everybody will get tear in their blood vessels when they go for neck massages or not. But when people have their predisposition, that means their blood vessels are a bit fragile, then they can have their tear in the blood vessel in the neck, and that tear can cause blood to be stagnant at that area, and stagnant blood can form a clot, and that clot can go and block a vessel in the brain. That's one of the cause or rare cause of stroke. Another rare cause of stroke is hole in the heart. We call it patent foramen ovale, or PFO. Many patients, or like many normal population, we have a hole which usually closes after birth. But if on some condition or some people, this PFO or the hole will remain open, doesn't mean that they all will have stroke, but this remains a risk factor for many people. So when the clot in the leg veins, that means your lower limbs or your abdomen, if there's a small clot, that can travel through the venous system, pass through the hole, and go to the arterial system and can cause stroke. So that's why evaluation of this condition after a stroke is also very important. For young patient, we do it routinely. So another question is, can plaque in the artery be removed or cleaned up? If yes, how? I'll say that there is no one method that you go and then you grease it out, everything, but definitely high level of LDL, or we call it as a lousy cholesterol in the blood, linked with the more plaque deposition in the blood vessel. So you check your cholesterol level and you bring your cholesterol level low, then there will be less and less plaque deposition.
We will probably take one more last question.
Yeah.
Yeah. Okay, are there any factors that may make a patient unsuitable for clot retrieval treatments?
So I think I'll talk here about both the method because both are treating methods. Okay, that means a clot busting injection as well as a clot retrieval therapy. So clot busting medication is an injection. We call it IV thrombolysis, and when we give this injection via a vein here, we actually giving a strong blood thinning medication in the system. So there are always side effects of every therapy, and the major side effect of this therapy is actually bleeding in the brain or anywhere in the body. So if patient has a history of bleeding tendencies, then we won't be able to give this medication. Or if patient is on strong blood thinner or had a recent surgery or operation which can bleed, we won't be able to give this therapy because we don't want to cause any harm. Then the next is clot retrieval therapy. For a patient who are on with minor stroke, small vessel which is not even visible on the CT angiogram, the clot retrieval therapy cannot work. But with the major vessel blockage, which is easily seen on the angiogram, CT angiogram, then yes, clot retrieval therapy can be given. Now, if patient has other things like tear in the blood vessels or abnormal vasculature or a difficult anatomy where your guide wire cannot reach to the brain, then yes, the neurologist as well as intervention radiologist will make a call that this therapy is not suitable for that patient. Yeah. There are many questions on blood pressure. I think what are the range of blood pressure which is healthy or what is advisable? I'll say that the best is you go to your nearby GP. They have international guidelines for controlling blood pressure. And again, I would like to appeal to all the patients, all the public actually, that when somebody diagnoses you with high blood pressure, don't hesitate to discuss more about it. Diet therapy works for a proportion of patient, but do not hesitate to take smaller medication to control it. Many of my patients says, I didn't take this because I thought I will take the medication and then I'll be dependent on this medicine for whole life. In that way, you are actually ignoring the major condition. So when your doctor or your GP actually mentioning that there is a problem going on and you also have symptoms and your high blood pressure is very high, then better to take a smaller medication early, control it, and then go for the diet control as well. And then you can discuss with your doctor that whether you can cut down the medication slowly, depending if your control is good. So better to identify the problem early and also fix the problem early. Okay. So I think my team is signaling here that I think it's time. Just one last message that use mask and social distancing because we are still in the pandemic time. Okay. Any questions regarding stroke? I think Celeste will give you more information on that. Thanks a lot.
Thank you, Dr. Ravi, for giving us such stroke information and helping to clear as much questions from the public. We would like to still recommend you to follow our Stop Stroke Facebook page and Instagram account to know more about stroke, as well as the Health Hub platform. You can search for Stroke Hub. There's an e-resource guide for stroke survivors and their caregivers. There will be a lot more information on those platforms than on the slides. Yeah. So thank you, Dr. Ravi, today. And we have over 200 participants today. Thank you for your warm support, taking the time to attend today's event. Please help to spread stroke awareness to people around you. And as you leave the webinar, there will be a pop-up evaluation questions. Please help to answer them and have a good weekend. Thank you.